Dr Shannon Lee from Pakenham Vets, and here this morning with Dr David Clemence of the Animal Doctors in Pakenham, Victoria, Australia. And I'm really excited about this one because this is one I've been waiting for a long time. David here is what we call an equine geriatrician, so he's going to give us lots of useful information for horse owners with older horses and ponies and how to care for them. So, morning Dave.
Morning Shannon, great to see you.
Yeah, likewise, really happy to be here. So how about we go and have a chat about how to care for the older horse and the older pony.
That sounds great.
Okay, let's do it.
Okay.
Okay David, so what would you say are the key points when looking after older horses?
I think we've really got to we see our older horses in a similar light to horses of younger and middle age, but just that if we do get it wrong, the consequences are greater. So always in any health program, it'll start off with getting the nutrition right. And we really want to cover off four main points in nutrition. First one is obviously roughage. Are they getting enough roughage, which should be at least 1.5% of their body weight. So for a normal 500 kilo horse, you'll be looking at about 7 to 8 kilos of roughage a day, which can either be grass or it can be hay or chaff. They're all interchangeable. With older horses, sometimes we'll have dental issues, which will mean that we can't feed hay. And also we might have such a large volume, because we're trying to provide calories as well, that we will have to use a high quality roughage. So therefore I would look for the type of fibre products such as a beet pulp to include that diet. Obviously vitamins and minerals are extremely important in all horses, but especially so, and I would be feeding that as a complete feed, one of the older horse specific diets from a reputable company, and of course the standout issue with older horses is their increased calorie requirement. So in order to keep those ribs at bay, we don't want to see any ribs, and often that will require a high calorie intake. Something safe, such as vegetable oil, really is a great helper. Their best kept secret in equine nutrition is vegetable oil, whether that be a canola or a corn, really doesn't matter. But again, for a 500 kilo horse, you're looking at 1 cup, a maximum of 1 cup twice a day, and really keeping those ribs away is extremely important. Second issue that is a standout for older horses is the management of any lameness issues. Obviously, older horses are more likely to have ongoing low-grade arthritis problems. These need to be monitored and treated accordingly, and also I include feet problems there. As horses get older, they're not exercising as much, their feet are not being exposed to the normal concussive forces that keeps feet healthy. Also, they tend to be more susceptible to founder, even if it's just mild founder, which will result in poorer quality feed. So lots and lots of farrier. Don't think that because the older horse, who may well be retired, don't think that they need to see the farrier less. They actually need to see the farrier more. So these are so feet are of critical importance in older horses, even though their athletic career has gone. Thirdly is general health care and making a once-a-year health care visit to your equine veterinarian is extremely important because we do, as we do with humans and dogs and cats, like all species, as they get older, it's Mother Nature's job to actually try and dispatch these older animals from the earth. She doesn't want to be using resources up on these older horses. Therefore, therefore the amount of disease that creeps in on older animals is just as relevant in horses. So we need to be proactive and try and pick up any illness issues as soon as possible, so hopefully we can manage them. The standout there is Cushing's syndrome, which is very common in older horses, and we can't just sit back and wait for the typical hairy coat. We really are. We want to try and pick that up. An annual blood test is a very good idea to try and make sure that we're not running into any liver problems, kidney problems, no signs of any infection. Once a horse has reached the age of 20, we strongly recommend 6 monthly dental checks to keep an eye on those teeth, which are now more susceptible to damage, to fractures. Also, gum disease can become quite rampant at this age, and while there will probably be no obvious signs for us to tell the outside, that's why we need to get in there and do a thorough oral and dental exam every 6 months. And the diseases that we see in the older horses, again, a lot of that will come from their sedentary lifestyle. So that includes our metabolic syndrome, which I think is included in other videos. 5 major areas we want to cover off on looking after our older equines. Number one, most important, get this right. Nutrition, making sure we've got a balanced diet, we're not getting too many calories. 2, lameness, looking after our legs. We know we're going to have increased osteoarthritis as we get old. We also know that our hoof quality is going to deteriorate as we age. So making sure we have the highest standards of care in these areas. 3rd area, dentistry. As we age, our teeth are becoming more fragile and we're going to get a much increased amount of gum disease. Let's get these checked every 6 months. 4th area, annual health care. Regular checkups. Getting a veterinarian to come out, look for those subtle signs of illness so that we can get on top of them early and have better outcomes. And last but not least, worm care. We know the rules have changed. We want to apply scientific standards and approaches to our worm control, minimising the amount of resistance and working with the horse's own immunity, not against it.
So for people watching this then, a typical scenario, for example, might be that the kids have had a pony, the kids have left home, and the parents are left with the ageing pony and who they don't have perhaps a great deal to do with. The pony gets older and it's time that they want some help in how to care for that older pony or older horse. So can you maybe run us through some scenarios, David, of what they should do or how to help them?
Yeah, I think the most crucial problem for most older horses that are really getting no exercise is their nutrition. And usually we find they'll be in a paddock with a lot of grass and they'll be severely overweight. And we need to come up with a nutritional strategy that will provide the balanced diet, but at the same time reducing our calories, especially to try and lower the sugar intake, which we know goes along with green pasture. Our pasture in southeastern Australia is very good for producing the milk, meat and wool, because it does have a very high sugar content, but this is probably the most inappropriate diet for an older horse who's really getting very little exercise. That increased sugar intake will result in a much larger amount of calories and will lead to obesity with its subsequent problems of laminitis, metabolic syndrome, and of course ongoing lameness. So some of the strategies we can talk about is actually the use of a grazing muzzle. These are extremely effective at lowering the sugar intake. Also making sure we get onto a proper farrowing program, and also trying to work out some way of getting some exercise for these older horses. There's no doubt that work is always one of the best things we can do for horses. This can be a real challenge in older horses. I think after we've spoken about nutrition, the next step is obviously an oral and dental examination. Being an older horse, we know the chances of significant pathology is much greater, and therefore a veterinary dental will be of maximum benefit to horses in this age range. I think one area where there is a lot of confusion now, and the rules are changing thanks to greater amount of scientific knowledge, is how do we prevent worms. And we know that we're moving on now from our blanket worming strategy. We have resistance problems because we are overworming as a rule. One priority for our practice is to safely reduce the amount of worming that occurs with the horses, and the only way that can be done is by the use of quantitative fecal egg counts, and essentially that is a program where every 2 months a sample of manure is tested for worm eggs, and the number of worm eggs per gram of manure is measured. There's a magic number of 200 eggs per gram. If the egg count is lower than that, then we do not worm, and we retest in 2 months' time. If we have a number greater than 200, then yes, we do worm. We use a product, moxidectin, which is the only compound known to kill our hibernating stages of our worms, and we then again repeat the egg count in 2 months' time. At this stage, we are recommending that we do at least 12 samples, so that would be a minimum of a 2-year period of these regular egg counts, and after that 2-year period, or 12 tests, we can then formulate an effective deworming strategy, and we're finding that in 80% of cases we can drastically reduce the amount of wormers that we can use. This, of course, we're finding this especially so in our older patients, because as a rule older horses do have a much greater immunity to worms, and therefore as a rule don't need to be wormed as often as younger horses.
Well, that's been really interesting. Thanks, David.
Thanks, Shannon. My pleasure, and I hope introduced you to the new and emerging world of equine geriatric medicine.
Fantastic. See us on equinedentalvets.com.